Lisa, we're talking about a lot of different pieces and parts of the ecosystem here, but it all starts with the North Star, as you pointed out at the beginning of the program, and these standards and the strategy that has to be put in place so that we're all pointed in the right direction. Give us a specific example of some of the activities that you all have laid, the tracks that you've laid down that have really helped to enable all this capability to happen.
Absolutely. Thank you, Luke. And I just first want to start by saying I take my hat off to my colleagues at VA and DOD and all the work that you all are doing. It's just amazing work. And as the granddaughter of a World War II veteran and the daughter of a Vietnam veteran, I just want to say thank you for the work that you are doing. As far as ONC, we really lay the infrastructure, as you've heard from my colleagues, we lay the infrastructure that allows the data to flow in a standards-based way. And so one specific example is our 21st Century Cures Interoperability Rule. And so as the provisions of that rule are starting to take effect, we're seeing a lot of what we have worked on for years, actually, to make this happen. So VA and DOD, the work that they are doing, that was from prior rules. What you are going to see in the future based on this rule is we require a standards-based, specifically FHIR-based, which is Fast Healthcare Interoperability Resources-based APIs, so that we don't have to build, 1,000 different APIs in order to interface with different electronic health records. We also put in provisions in regard to information blocking. So we outlined the exceptions because it is our position that a person's information should flow in a safe and secure manner to wherever they need it to flow and give permission for it to flow. And so in our rule, we also address information blocking, and specifically something that you may be seeing in your personal lives is faster test results. So a lot of you are probably starting to see notices from your doctors that say, you may get your test results, sooner, quicker. Just make sure that you are prepared to read your results. And we work to make sure information is available because we believe that information is power. It is the great equalizer. It allows us individually as patients, as caregivers, to be able to be active participants in our care. And so our rules have an impact not just in the government space, but across industry and in our lives personally. And so we have considered that a great honor to be able to provide that infrastructure that the industry rides upon.